How human biomonitoring for European Union, HBM4EU, bridges science and policy. In our everyday lives, we are exposed to numerous chemicals that are produced by industry or occur naturally in our environment. Not all chemicals pose a health risk, but exposure to some chemicals can affect or even seriously damage human health. Human biomonitoring provides a tool for monitoring the exposure of the European population to chemicals. HBM4EU is a large-scale EU project that aims to provide scientific data to support policymaking to reduce negative health impacts of chemicals for European citizens. HBM4EU is bridging science and policy, exploring current questions to deliver answers that help policymakers to protect human health. Our evidence will support policymakers at different stages of the policy cycle, including inception and design, implementation, and evaluation. How science-based results can be used to recommend policies and track policy efficiency. HBM4EU refers to information on the safe use of chemicals based on human biomonitoring data. This requires the collection, compilation, interpretation, harmonization, and dissemination of human biomonitoring data. Policymakers use this as a basis for supporting policy actions. HBM4EU produces high-quality data on exposure of European citizens in all European regions, thus giving an overview over exposure in Europe. HBM4EU applies human biomonitoring to measure the exposure of the European citizens to chemicals, e.g. in urine or blood. Obtained data helps to understand how we can protect ourselves. HBM4EU produces concrete evidence of how chemical exposure impacts human health. Policy cycle and the role of regulatory agencies. How is human biomonitoring, HBM, useful in policy? The public policy process, in simplified form, can be understood as a sequence of 4 phases. Agenda setting. The prioritization of chemicals was done in a cooperation with national and EU policymakers. Policy formulation. HBM4EU is developing a process for the joint interpretation of HBM results between regulators, scientists, and stakeholders to foster consensus around results and their translation into targeted policy measures, implementation or carrying out of policy. HBM4EU partners have already engaged in dialogue with decision-makers and stakeholders on how to interpret human biomonitoring results for use in policymaking, with a focus on phthalates and bisphenols. Evaluation of implemented policy with the means of human biomonitoring and continuous research projects. Science can be incorporated into every step. HBM4EU bridges science and policy, for example, using scientific data of human exposure to chemicals and its associated health impacts throughout the product lifecycle to enable policy decisions to make products safer. Providing guidelines to be able to interpret exposure data in the light of health impact. Establishing guidelines to protect workers from occupational exposure. Estimating health impacts that emerge when a single person is exposed to several chemical substances at the same time. Searching for new chemicals that pose a health risk and providing evidence to policy bodies. We conduct human biomonitoring through harmonized approaches in Europe, providing a network for monitoring the exposure of the European population to chemicals. This data is reliable and used to track the efficacy of policies in minimizing human exposure to chemical substances. It also shows the trends in replacement of chemicals that are subjected to regulation. HBM4EU is unique in its effort to combine capacity building and the creation of a link between policy and science by establishing national focal points in member states while conducting cutting-edge research. We have designed the science-policy interface in a way that ensures close contact and exchange with policymakers at national and EU level. Our results are used by policymakers since they answer specific policy-relevant questions, clearly communicate scientific results, and are delivered at the right moment. To meet these criteria, HBM4EU partners are actively identifying openings in regulatory processes on chemicals where they might feed in evidence. HBM4EU cooperates with an EU policy board consisting of the European Commission. We have fed results and data into chemical-specific regulatory processes, such as consultation processes on plasticizers and persistent organic pollutants led by the European Commission, the European Chemical Agency, the European Food Safety Authority, and Secretariat of the Minamata Convention on Mercury at the United Nations Environment Program. With our data, we are producing indicators and the baseline against which the success of the EU Chemical Strategy for Sustainability, the Zero Pollution Action Plan, the Farm to Fork Strategy, and other objectives under the European Green Deal can be measured. We have already identified gaps in the effectiveness and mechanisms of current European regulations and the respective risk management for which we will propose solutions. HBM4EU results support concrete regulatory measures for priority substances, such as the proposal to ban the whole group of PCFs, perfluorinated compounds. We have also contributed to setting up the next research agendas at national and EU level. The data used and produced under HBM4EU have been made accessible via IPChem, the Information Platform for Chemical Monitoring. IPChem is the European Commission's platform for searching, accessing, and retrieving chemical occurrence data collected and managed in Europe. This platform is freely accessible. Several EU strategies will benefit from HBM4EU results, such as Chemicals Strategy for Sustainability, Zero Pollution Action Plan, Green Deal, Farm to Fork Strategy, Biodiversity Strategy 2030, New Circular Economy Action Plan, Just Transition. The European Commission has funded an EU partnership for the assessment of risk from chemicals, PARC, in the new Horizon Europe Research Framework Program for 7 years. PARC, which includes 200 partners from 28 countries, will follow HBM4EU and build on its results. The HBM4EU project and the follow-up PARC project are excellent examples of initiatives to deliver better monitoring data and intelligence to track progress in delivering zero pollution of humans and the environment. HBM4EU is for you. We work together to improve your health.